But today, we have a lot of material to be built, like composite tools, the rucksack, or the temporary. Here I copy the temporary. I did in a single session by myself. Of course, characterized anterior restoration like veneers or crown is demanding, and the same restoration 4 years later. We can do multiple restoration of the same quadrant, as you can see here. Here I removed the two minor restoration, one restoration, but I think that is a very promising restoration when compared to the full crown, the normal full crown restoration. Why to do endocrown on posterior? It's simpler, less invasive. We don't need the technique is to put the scap body, scan the quadrant, scan the antagonist, and the bite. That's all. After the peeling cap removal, this is the proposal. Now we have to choose between screw retained crown or cement retained crown.
To crop, how to take the picture, because we don't take a picture, we make a picture. So we have to know what to show in our pictures, and sometimes they are posting some videos. So they started like this, and sometimes they were showing pictures like this with a trash can, and now they are able to post this kind of pictures in these groups. And imagine that even in the workshops they are posting some documentation, and they are able to document. This is an undergrad student, and she's able to document this quality of pictures without any kind of light, only with a mobile. Everybody has a professional camera. And if they have a professional camera, they don't know how to use it. So this is the main problem. And when you are using your mobile phone, you are using your mobile phone in the wrong way. When you know how to use it, you will have great result, as you will see, because everything can be done with your mobile. In our professional program, we will not only talk about mobile dental photography, we will talk about professional photography with a professional camera, and you will see what are the settings for this camera, and you will see, for example, how to do this great picture. It's very easy to do such pictures, but you must know how to do it, and we will teach you everything. So a little bit of history about smartphones. That's why when you have this device, you have the polarizer, and you can make polarized pictures. So to take the color, to take the polarized picture, you need this kind of filters, and you will have it for free with your light. So I started with one device, with one smart light to take the interiors, and that was the result. And you can use only one to take the posteriors. So this is also the result for posteriors. But to have the effect of twin flash, the light coming from mesial and distal, I was using two smile lights. So to have this effect, I was using two smile lights. But to use two smile light, my assistant was holding this smile light. So sometimes she was moving, and I was not having a predictable result. That's why I got the idea to do a prototype. And that prototype was fiberglass. One of my patients did it for me. So we put the light, and we have always the same place for the light. device just to know the measurements of this device, and then we started to do the measurements. This was the first perspective of the device, and then we adopted this one. 2 years ago I got the first prototype, and believe me, I had tachycardia because it was for me like a dream. And 1 year after, or 1 year and a half after, we launched the first device to use on the mobile. It's SmileLight MDP. It was launched in January 2017, and it's a device that everybody can plug on the phone, and everybody can have this quality of pictures even with his phone. So as I said, light, and you have lateral light, and you have the lateral lights. So you have like a twin flash effect, and you can use a polarizer. You can have diffusers to have effect of soft boxes. So it's a mini studio where you can plug your phone here, and you can use any phone from 35 to 55 millimeters. So all the phones can be used, and this is how you place your phone. The camera must be centered in the viewer, and you can start to shoot. If you put on the central light, you will have the ring flash effect. You will see the light reflecting on the buccal surface. If you use the lateral light, you will have the twin flash effect coming from mesial and distal. If you put the diffusers, you will have soft light coming from everywhere, and this is how you will have when you use the So just to show that it's very popular and everybody wants to know how to document easily, and this post was sent to 1,180,000 people. And MDP now is not a joke, because you can see that now a lot of people are willing to do courses for photography. And next year in Sevilla, Quintessence is doing a big congress for photography, where you can see the giants of photography like Carlos Ayala Paz. You see that the difference is not that obvious. The difference is getting closer, and you see that that was for Samsung, this is for iPhone. Even for all the phones, you see that we don't have a big difference between a professional and a phone. What I did is, what we did in Star Italiano is the light, but the cameras
between MB2 and MB1 in this case. But in any case, without any magnification, it's impossible to do it. Same for the lower molar, where a lot of time we have a lot of isthmuses, and in the isthmuses we can check the root canal system. We can have an extra anatomy and extra canals. Of course, we have to change the dimension and the shape of our ultrasonic tips, but carefully we can clean and remove dentin in the selection way. Dancing vaginatus, and in the CBCT, the two systems looks independent. So that's why we try to treat only half part of the tooth. It's a young patient, so we have to follow the minimal invasive approach as much as is possible. So we have to open the access. We have to remove the densum vaginatus, do the apical plug, and this is a post-op with the build-up. First control 6 months, 2 years later, 4 years later. The completing healing treated just half part of the tooth. So great success, that depends on rationale for treatment, cleaning concept, three-dimensional obturation, but of course, in this case, the use of microscopy. Then try to remove the instrument without any magnification. So he did the perforation, so now we have to face two different kinds of problems. The perforation and the broken instrument, but we can do it. This is the final results. Well, we remove the broken instrument, we repair the perforation, and this is the follow-up 13 years later. we don't need to remove all the gutta percha inside the canal, but it's enough to remove the gutta percha in the middle 1/3, coronal middle 1/3, and then pack that area with the MTA. And it's really easy to do it because with any system, I'm using map system from this comes from PD Dentaire, but it's the syringe that can allow us to bring the MTA easily inside the canal or inside the apex when we are talking about endodontic surgery. And the procedure is really simple. Sometimes we can try to perform this kind of technique also without microscopy, because it's really, really simple. Because pack the entire, to do this kind of retreatment, how could be the success rate of our non-surgical retreatment? Because the first treatment was very nice. So in my opinion, we don't have any chance to remove, to solve the problem with a non-surgical approach. That's why we can clean, shape, and pack in a retro way the root canal system. Well, the healing, and this is the last control, after 18 months. Only 18 months. We have to open it a little bit more, but we can do it. And here the lesion. So now, after the remotion of the lesion, we can control the operative field. We can introduce hold the technique to control the bleeding. We can clean with the ultrasonic devices the growth tissue. And now the situation is more clear, and we can see the lateral canal, but there is another one. There is another one. So, with a very small explorer, we can check the second portal of exit. And now we have to do exactly the same that we did in the previous case. First, we start with the smallest ultrasonic tip that we can use in endodontic surgery. The name is Slim Jim, just to make the first preparation of the anatomy, and then we can move to another ultrasonic tips bigger. We are working. After the surgery, if we use ferric sulfate, we have to clean everything inside of the bone, and then the suture. The choice for this kind of flap, one of the most important reasons that we choose this kind of flap is that the papilla preservation flap is one of the most interesting flap for the accurate position of the flap during the suture. That's is very important for the tissue healing. Now I show you, this is the first control, only 4 months later, and now I show
afford them because my patients have two things: no time, no money. Okay, this is the problem of today's patient. So that's why sometimes we're going for them. So look how in this technique we make only the front part of the diastema. And this is something that when you understand it, it will change your life. Look how I polymerize the central part. We adjust a little bit the incisal margins. This is very important. Because don't go only for the single thing. Look around what's happening in the other teeth, in the other regions. Okay? So this is another trick we're going to see during the program. It's called the texture transfer. Very useful. So once I polymerize these two, we're going to make only the frontal part of the by doing what it's called the snow plow technique. So you go through the back, place a drop of flowable, and then pack some kind of material. So you push two materials at the first time. So all the flowable material will be flowing on the vocal part. So when you have this excessive material, you know you are not having a single bubble. So the quality of the material that it's closing from behind, it's of extremely high quality. So when you polymerize both, look at the contours. They're extremely perfect. So then finishing and polishing a very dense and well compacted material, it's amazing. So this is another one of the techniques we're going to see. Can you imagine the amount of enamel I have to destroy for what? For having a margin in the dentin. So I think here, going tooth by tooth, cleaning one by one, making a front wing, like you see here in the mesial of this area, then a distal, placing the matrix and doing a closing up technique, like the class 5 I show you, you have amazing results. Very conservative without the need of grinding enamel, because enamel is the best coin you can have when dealing. To leave you with one of my favorite lecturers and partner in crime, Dr. Walter Devoto.
It's quite easy to try to make the best, but chairside, when you have to take care to the tri-dimension of the tooth, when you are layering the measurement with the spectrophotometer. And if you take a look to this number, they are very close each other. Means that under the human eyes, there are no differences if you go multi-layer or if you just go one. Why? Because everything depends on the thickness of the tooth itself. So the same A3 cervically, it looks like an A4, and incisally instead, it looks better like an A2. So at the end, following the technique that you see at the bottom, you can be faster and you can be much more precise to get the point. So that's helped you really to create a last room for the next level of enamel, which can fit and can give really the vitality of your restorations. So from a multi-layer solutions, I move to what we call controlled body thickness technique. Means that we control the thickness of the dentin before curing it with our instrument, the misura, and then we cure the dentin, and after that we add the 0.5 millimeter of enamel. We published those kind of stories and technique in 2010, and of course this is the technique that we are performing in my clinic and in all the group. I just want to tell you some kind of tips that of course we are going to explain better in our professional years, and really this is the revolution The new material, the nanomaterial, they are totally different in quality. Believe or not, I haven't repolished such a restorations. I just ask the patient to come every 6 months for the check, for the cleaning with my hygienist, but you can see the quality of the restoration that they are still in the mouth after 6 years, and I can believe that they will last longer.
Inshallah, their school is nice, clean.
Area around the implant. I measured the defect, and you can see 10 millimeters. The defect, the implant was 11.5. This is 10 millimeters of defect. And I decontaminated the surface of the implants, the connection of the implants. I put the chlorhexidine gel into the connection, and I closed with the sterilized cover. I shaped the membrane and fixed on the lingual side, and then I grafted the material around the implant and closed the membrane on top of the material. And 5 months later, these were the quality of the soft tissue. I don't know if you know the barrier that I used. Below the membrane, there was regenerated bone. Completely. And this was the situation at the beginning. And if we take in consideration the opportunity that
the bonding system, the bond strength is higher than when it's combined. If this was a question.
Yes, because some hydrofluoric acid they silent. Say what
correct.
hydrofluoric acid they put bonding agent and saline is not needed.
Correct. So first for hydrofluoric acid, then silane, then the bonding. The keeping the steps separated on the ceramic side, there are basically.
Then you restore it, right?
Normally 6 months, and then after 6 months, I remove the membrane and.
Hi. Hi, mommy. Yahya. We.
So, I'm Dr. Saba Ghazal, a diplomat of the American Board. I have a question for you. So, regarding your vertical augmentation at the same time of implant placement, I like your technique and everything, but do you face, like, what my understanding is you leave the implant 10 months?
طبعا رأيي كان المؤتمر كويس. أنا دكتورة صبا غزال. كان المؤتمر كويس شوية، كان أكثر إعلان عن الكورس أو الشيء اللي هم يسووه من أي شيء ثاني. طبعا مشكلة دائما الحضور أو الليكتشر اللي نجيبهم من برا إنه يكونوا they're not expecting إنه we know anything، فيكون sometimes it's more basic than what we want. بس in general it was good to hear، يعني تشوفوا other ثقافات مختلفة وأسلوب كلام مختلف. بس أنا صراحة الجزء اللي ما عجبني إنه كان أكثر إعلان عن البرنامج اللي هم عندهم إياه من أي شيء ثاني. شكرا.
Yeah.